Okay. Good morning, everybody. Could you please take your seats? I think we need to start. Well, first of all, to say welcome, everybody. Wonderful to see you all here. It's wonderful for you to come and join us to celebrate 10 years. Yes, 10 years of the Center for Global Mental Health. I am Ricardo. I am the director of the Global Mental Health Center for King's College London. And we have a full agenda for today. I hope you will enjoy it. There will be plenty of opportunities for you to interact with some of the people who will come on stage. But let me, first of all, invite our Vice Principal International, Professor Fumi Olotonakian, to give us a warm welcome to the day. Fumi, please.
Good morning. Good morning, King's people. King's people, distinguished guests, colleagues. I think it's my singular honor, I would say, to welcome us to this celebratory but also forward-looking event. And I think the timing of it is perfect, Ricardo, in several respects, as far as I'm concerned, wearing my hat as Vice Principal International at King's. A few weeks ago, King's Council approved our new internationalization agenda for the next 10 years. For the past, for 18 months before then, I went around King's campuses through focus group discussions with our students and staff, but also through a special survey of about 500 staff members across all faculties. And I tried to understand our staff members and our students' vision of internationalization in order for us to really understand the values that we share, but also the vision that our staff and students have for the future, if we're going to set a 10-year agenda. And I'm pleased to say that one of the cross-cutting themes, one of the constantly emerging subjects, which we know this at King's as well in terms of our own university responses to our students and our staff, but was the subject of global mental health, in particular, within a global health context. And what is it that underlines our internationalization agenda? And why do I say global mental health sits at the core of it? The first is our own identity as King's people, the values of cultural competency, which underlines that identity, as well as a global problem-solving mindset. And those two values define King's people. But second is how our systems, a systemic embeddedness, a process of embedding these values across the things that we do. Because when we talk about cultural competency, it is clear to me and to all of us, drawing from the sorts of responses I got when I went around King's, that in its simplest form, it's about seeing the world through the eyes of the other. That other in their diversity, all right? Whether we're talking about gender, race, disciplines, geography, whatever it is. And this defines King's people a lot. We have home students and international students of almost equal measure with similar identities. So we're not just about international staff and students. We're about the whole of King's, seeing the world through the eyes of others, but with a global problem-solving mindset. And that's where global health and global mental health will sit really at the core of what we do. And when one of my students, on the intercalating degree, who did a research her dissertation, which I just contributed to reading as second marker as well, that others have read because of what it consists of, worked on global mental health. And she simply defined the absence of that healthy mind in whatever way, in the same way that Galton would do, as absence of peace. So as violence of a sort. So peace in that sense for the individual rings through everything. That's why when you look at the brochure that I saw online, which marks today, and it says when it comes to mental health, all countries are developing. That is striking. And it takes us to the third part of the strategy, which is about global reach. That global reach is exemplified in the work of on global mental health at King's, what this center has done in a decade, and has managed to reach the work of so many people across all regions of the world, whether we're talking about Africa, Asia, the Pacific, Latin America, is incredible. I saw it firsthand myself in Addis Ababa earlier on this year in March, when I saw how the Amari program has reached the next generation of researchers. That's why this student's dissertation about research, about researchers as leaders, rings a chord, you know, it just really resonates with all of us. That those who will research mental health, those who will respond to it as a global challenge of our times, must have underpinning it these values, which means if we see it as a global challenge to be solved, we will penetrate those countries that have an absence of response. In the region I'm from, that's the core message, that we do not have nearly enough responses in terms of research and policy and the resources to reach to the millions of people that could benefit from mental health research and programs and so on. And I think this makes what we're doing today, reviewing the past decade or so, looking at the partnerships we have and looking at where we want to go, and hearing from our researchers and scholars who do this firsthand, but also are responding indirectly. I think it's a thing for Kings to be proud of, and I want to welcome everyone to this day. I shall try to be present in bursts as much as I can be, because a lot of my colleagues who run these programs are here and showcasing their work and thinking for the future. Thank you so very much. Have a good day.
Thank you so much, Fumi. This is a very good starting point. I thought you mentioned learning from the past, one of the biggest failures of humanity. So I thought we should start the program with kind of talking a little bit about how did it all started. And I want to invite the two people who were really the founders of the center, Professor Martin Prince and Professor Vikram Patel. They would probably, if they want, they would introduce themselves, but you know, they're so well known that perhaps there is no need for an introduction. Could you please come on stage? Okay, well, we thought we were going to change a little bit the format of these and make it like a dialogue. There will be an opportunity for you people to ask questions, but I thought I wanted to ask them some questions about the past. In the afternoon, there will be another roundtable where we're going to talk about the future, but we're going to talk about the future with some of the young people, and they will be able to question some of the founders about the future. That will be probably more challenging than this one. So I just wanted to start, with you, Vikram. If you could give us an idea, how did it all come about, really, this idea of having a center for global mental health?
So the first thing I want to say is happy birthday. I kind of feel like a parent who's come back to the 10th birthday party of a little baby that was co-conceived, not just by Martin and me, but it was a collective parenthood, really. I also feel like a neglectful father having abandoned the baby, but I'm so thrilled to see how much the baby has thrived and grown in spite of an absent parent. And in India, you know, when we celebrate a birthday, you have a little sweet. I don't have a cake with a candle, but typically one parent asks the other parent, gives the other parent a bite of the sweet. So in complete respect to my tradition, and let me start by first acknowledging that this was a process of great fun and some hard work. So I want to, my own memory is as such. Back in 2007, the Lancet Medical Journal gave us an incredibly important opportunity to talk about mental health in the global context. I don't know if Richard Horton is here, but
he is here.
He is here. Well, he is. That's terrific. I don't see Richard, but oh, there he is, Richard. Well, brilliant. Because I'm so glad you're here. I have to say that for me, the journey for this field really began with his championing a subject that, to be honest, no leading medical journal at the time would have really given any attention to. And his immediate response to Martin and my email to him suggesting a series in the Lancet following on from similar global health series, the speed and the warmth with which he responded really set us on the road to where we are today. After the series was published, which really caught a lot of attention in the global health community, it seemed to us that really there needed to be some follow-up action, and that action needed to engage many different communities, for example, civil society, and so the Movement for Global Mental Health was launched the following year. We needed to launch a research program, and so the Grand Challenges in Global Mental Health was launched by NIMH. But we also needed to launch an academic center that continued the task of generating new knowledge, trying to work towards its adoption and translation, and provided a place for learning for younger generations of students interested in the field. And I think that's really how the Center for Global Mental Health really took hold.
For those of you who don't know, I asked Vikram, as you know, he is a distinguished professor at Harvard University. So I asked him to bring a cake to celebrate the birthday. And look what he brought us. Anyway.
I forgot it at duty free. I'm sorry.
Yes. He always got an answer, Vikram. You'll never be short of that. Martin, if I may ask you, I mean, there have been so many challenges in the creation of this sort of center. And one of those which has been kind of sort of haunting us forever, it is bringing together two big organizations to agree on creating something with a joint collaboration. Could you share some thoughts about that particular challenge?
Sure. So I promise I won't come up with many more birth analogies. We don't want to make this too obstetric. Vikram actually said to me when he arrived, he said, "Martin, this is great. It's just like a birthday party." And I said, "It is a birthday party, Vikram. That's the idea." It's amazing that it's 10 years now. But I think the antecedents of the Joint Centre started, in a sense, much earlier than that. I agree that the Lancet series was absolutely pivotal and catalytic, I think, in creating the groundwork for the centre. But actually, in many ways, we have, I think, the Wellcome Trust to thank for this, because Vikram and I both studied for our PhDs under Anthony Mann at the Institute of Psychiatry at King's back in the late 1990s. Vikram doing his work in Zimbabwe, me in Gospel Oak in North London. Vikram began to draw me personally, I think, into working in the global mental health field. First of all, looking at issues around aging, long-term care and dementia in Goa in South India. But as our friendship grew, Vikram pondered what next in his career and applied to the Wellcome Trust for a fellowship and was told, well, that's fine, but you can't do that at King's College London. You need to actually do this through one of the global health training centres that was established. So Vikram looked around and the London School of Hygiene welcomed him with open arms. So you moved there, Vikram. In fact, I'd worked there myself between 1996 and 2000, so knew many friends and colleagues there. We had jointly started a summer school at King's and a programme of annual conferences in what we called International Mental Health at that time. And I think before we actually started the Joint Centre, we'd already actually started a joint module in global mental health at the London School of Hygiene that King's students could access as well, which I think was one of the most popular modules actually at the London School. So in fact, many of the conditions for creating a collaboration really already existed. Vikram, you were very well entrenched at the London School of Hygiene at that time. And I think what was in our favour was that global mental health was on a really good trajectory at that time. That was where the Lancet series really helped. It also was in our favour that actually both King's and London School of Hygiene were looking more broadly at opportunities for collaboration, and this was the first concrete possibility that came about. It was fantastic that we had the support of very senior figures in both institutions, Peter Pearce at the London School and Sir Robert Leckler and the principal at that time at King's College London as well. So I think everybody saw the mutual interest in this. I think the other thing that was actually probably in our favour, but I might come back to this later, is that we weren't really asking for much. We were offering a lot. We were saying that, you know, we're going to collaborate more in teaching and education. We're going to look at developing a joint MSc. We'll be the first centre for global mental health worldwide. And we think there are significant opportunities for developing education, training, and joint research.
Thank you, Martin. Well, it's interesting, actually, because the three of us have worked in both institutions. Yeah. The three of us trained, actually, at King's College, and then work at the London School later on. But I wanted to ask you, come back on that point, Vikram. Having worked at the London School for a while, the London School has no tradition. I often, when I went around the world giving talks and stuff, you know, people would say, so what are you doing at the London School of Hygiene and Tropical? What does mental health have to do with this? And the London School doesn't really have a tradition on mental health. I mean, how did you manage to persuade the London School to take on mental health as an issue of importance?
So I think it'd be first fair to say that the London School does have a tradition of mental health, but with a very domestic focus. My sense is that virtually most of the professors in psychiatry in this country who have got an epidemiological area of work have probably trained at the London School, including Martin, and I think many of the others who have gone on to occupy chairs, in various departments in this country. So I think the school has had a history of outstanding epidemiological work, and that spans all areas of medicine and public health. But you're right that at that time, it had no real substantive interest in the global context. I think it's an interesting thing when I look back. There were many people who were already intrigued by the possibility that the agenda for global health went beyond infectious diseases and maternal and child health, which dominated the conversations in the 70s and 80s at the school. And before Peter, I have to say, it was Andy Haynes, who was in fact the director. And Andy was already working in areas like climate change, which necessarily go way beyond narrow disease areas. So I think his shepherding and encouragement was extremely important. There were many other senior colleagues like Betty Kirkwood, who also saw the importance of going beyond a narrow agenda, could see the future of global health lay in very many different, addressing very many different topics. So I think it wasn't all that difficult. But I think what Martin says is critically important here. There wasn't really a sense of competition with King's. In fact, there was a sense that what we lacked at the school was a really deep expertise in mental health, and rather than duplicate it and try to create something which would simply not be within the remit of the school, why don't we partner strategically with the Institute of Psychiatry, which was, I think, the main partner within King's then, because they would bring all the mental health expertise, the school would bring all its global health expertise, and together the sum would be much greater than the individual parts. And Peter, I remember, actually, I do remember one very good memory that comes back to me. When Peter Peart was about to be appointed, he had been offered the position as director of the London School. And I remember he made it a task to go and meet people in the school just to sort of get to know them better. And he reached out to me, and he took me for coffee. And the first thing he said is, I know what you think here. Here I am from UNAIDS, and you think I'm going to make the school an HIV research institution, and I'm here to tell you that I do not hold allegiance to a narrow interest, and I'm here to support everything you do. And I remember that very well, the director of the London school actually reaching out to a junior person in the school. So those are the sorts of memories I have of absolute complete support. And I think the final point is we weren't asking for money. That always helps. So people say, yeah, go on, start whatever you want. You might bring in money.
Well, that takes me to my next question to Martin. I mean, I know there are a number of people here in the audience that they've set up or they're trying to set up your own global mental health centers. And so my question to you, Martin, is what would be your advice for those people in here who want to start in this sort of process?
Okay. So I think that was one of the things, in retrospect, that probably I would have done a little bit differently at the outset, because we really did ask for and get very little at the outset. So we got a small amount of administrative support, I think, in each of the two institutions. And we got a joint lecturer who was 50% appointed at King's and 50% appointed at the London School of Hygiene and Tropical Medicine. But we had a very full, ambitious and active agenda right from the very outset. So we hit the ground running, and we started up the MSc in about kind of 18 months, I think, from the inception of the centre, which was an entirely new programme and one that was actually taught and run jointly across each of the two institutions. So that involved a huge amount of work. At the same time, we were continuing to run and coping with growing numbers of people coming to our summer school from all over the world, and running an annual conference. And at the same time, after the Lancet series, there was increased research activity and collaborative research activity, particularly with the DFID Prime Consortium, which Crick Lund ran for 7 years, and for which we were the evaluation partner, or one of the evaluation partners on that program. So there was a huge amount that we were trying to do, and yet really pretty much all of the enterprise was run on what is called inverted commas soft money. So not even people on university, on university contracts, but actually to a large extent research grant funded. So we were promising a lot, and we delivered a lot. And I think we probably could have been more ambitious in trying to solidify the structural arrangements for the centre right at the very beginning. And I think it's one of those problems when you have a centre or an institute, they're all very virtual. And in a sense, everybody owns them, and yet nobody owns them. So if you're trying after the inception to secure resources, it's quite difficult to actually do that. So I think it's worth thinking through what you want to do, how you want to grow, what your ambitions are, and being quite ambitious in the ask as well as the promise to your university. I think we missed out on that a little bit. I think it's also important to manage upwards, particularly for a joint university centre of this kind. And I think, again, in retrospect, we could have given a bit more attention to that. So I think we tended each to report individually back to people in our own institutions. But what we didn't do was to actually bring those two institutions together, since they co-owned the centre, and to really get them to acknowledge the progress that was being made, but also to understand the needs of the centre for its future growth and development. So obviously, everyone needs to start small, but I think be ambitious, be clear about what it is that you want to achieve, what you need in order to achieve it, and take that forward. The other thing I think that probably it would have been good to give more attention to right at the very beginning, in a slightly more formal way, is not only the internal relations within your institutions, the relations between your institutions, but also your relationships with partners outside. I think Our relationships with partners outside have been very satisfactory, very productive. They've grown, they've developed. All of them that we had at that time are still in existence now, and we're taking on new partnerships as well. But I think thinking through what your strategy is from the very beginning, what you want to do in the partnership area, whether you're in a low and middle income country, in a low resource setting, or whether you're a high-income country institution working in the global mental health or global health space, I think it's particularly important to think through what does partnership mean and what will be the defining principles of those partnerships and how are we actually going to behave in such a way that we ensure that those principles are fully adhered to.
Is there anything you want to add to that, Vikram, before I open up for questions from the audience?
Well, I mean, I agree. It's interesting. We haven't discussed any of this, so it's interesting. Half the things that I'm thinking of, he's saying, which is perhaps a sign that we're very much still bonded in very interesting ways. I want to say a couple of things. First of all, it's obvious that the fact that we have a friendship is important, and it's hard to really put a kind of a tangible and protocol around how you can set up centers by forming relationships. And I have no doubt in my mind that had this relationship that actually for Martin and I began when we were psychiatric residents in the same ward, before we had any idea that we would ever even be academics. So I think the importance of relationships is really critical here on when you're trying to do something collaborative and setting up something that is so ambitious. But I think looking back in hindsight, I think we focus more on our relationships and our partners than we did within our institutions. And I say this certainly within the London School, as you know well, because you've been there as well. So I can't speak for King's, but certainly at the school, had I been knowing what I know now, I would have made a huger effort to form relationships with the very important non-clinical disciplines, disciplines like economics, anthropology, and so on. I think in hindsight, the whole critical social sciences approach was perhaps not well enough engaged from the beginning. And I think in many ways, the Lancet call to action was so focused on improving access to services, which was, of course, what the call to action was. And so our thinking was so directed towards that particular goal. We didn't fully acknowledge that there were many other ways of looking at that particular call for action, partly because we both came from the same crucible. And I think that was, in my mind, a shortcoming on my side, certainly at the school.
That's really interesting because you will hear from our jewel of the crown, our MSc program, the kind of people, our clients that come to the course, the wider background of people who come to that, and it exactly touches on what you're saying. We get a lot of people come from social sciences to join the course. So we have a little bit of time for a few questions. So if you just simply raise your arm and somebody will come with a microphone.
This one.
We have one person here. Sorry, it's going to bring you to the front, but we'll certainly keep you fit.
Hi, I'm Valentina Yammi from the London School of Economics. I have a question about your journey and the future of this journey in particular. I'd like to know, how do you see the role of global mental health in a world that is becoming more and more polarized, between governance and collaboration on one side and national sovereignty on the other side?
Who would like to take? I think that's probably a question for a real politician. Shall we leave Vikram to deal with that?
Look, I have to say, Ricardo calling me a politician, I don't know. I know always you use words very carefully. But I'll tell you what, this is a question that requires the rest of the day for me to think about. And since I don't know if we're still coming back together in the evening to talk about the future, I could talk to that. But I'll say a more general thing. It's obviously inescapable to all of us that the last year has been one of grave concern to each of us. And we don't have to talk about this from a mental health angle alone. I mean, I think it's about cohesion. And inasmuch that we accept that social cohesion is such an important determinant, and one that we did not, a good example of something we did not actually explicitly address in our early conversations in the center. The idea about social determinants was something that almost followed on, particularly social cohesion. My sense is that this is a subject that is of grave concern. A couple of indicators that worry me greatly. Last week, the US CDC published its annual surveillance data on mortality in the US and reported that mortality rates due to suicide in young Americans had doubled in the last decade. Now, if you just pause and think about this, just pause and think, any other cause of death doubling in 10 years, it's almost like an epidemic, right? The word epidemic is one I use very carefully when you talk about a non-infectious condition. But it struck me that something is going on within a very toxic environment in the US as perhaps one exemplary example of a divided society. To what extent this can be attributed to the polarization, I don't know, but I think it's certainly a very important subject for global mental health to begin to interrogate.
I think we have time for one more, Tessa? One more? Okay, one more question. I think the audience is warming up. Okay. So, shall we leave it in there? Mm-hmm. I mean, please join me with a round of applause. You know, Vikram and Martin are not just simply... They're not just simply visionaries, but they have that critical combination to make things possible. They have a vision, but they are also what I call doers. So those are really two key things in order to get things up from the ground. Thank you so much for joining me.
Thank you very much.
Probably all of you have in your chairs this, right? Okay. So what you... Yeah. Okay. Can you hear at the back, by the way? More or less, not so good? Okay. I'll try to speak as close as I can from the microphone. So I just wanted to share with you some of the highlights of the report. And it's here. I knew I had put my notes somewhere. And well, you know, first of all, I just wanted to say that it's incredible, really. We've had a series of events leading to this meeting today. And it's incredible that we are here, you know, and to me, having achieved, you know, who would have thought 10 years ago that all these achievements, which are summarized in here, would have been possible. Martin and Vikram mentioned that a lot of these has been done, to put it mildly, with a low budget. And it is true. It is true, and it is true that 10 years ago, the climate was very different from what you see in here. It's really refreshing for me to see so many young people here, I must say, because we really need to start thinking about what I call the replacement generation. You know, as some people get older, others have to take control, like it or not. We wouldn't like this wonderful thing that has been built with so much effort to disappear. And it will be left on your hands, some of you, the younger generation, to carry on and to move the torch forward. The center was created with a very kind of limited, narrow goal, which we call the mission. And you have to realize, as Vikram was saying, when things happen, there was a period just before the creation of the center that it was kind of flooded with information coming from epidemiological surveys. And at around that time, just to put things in a context, the global burden of disease came about. And that was a real shock for the world. Because for the very first time, we came to realize the real magnitude and impact of mental illness throughout the world. But at that sort of time, we were thinking, we know there is a problem. That is, some people used to say, we are tired of counting the dead. So what is it that we can do to change this? And I think the center, the original mission was very much shaped by this. And the idea was, what can we do to reduce the treatment gap? What can we do to provide solutions for this massive problem that it was emerging? And so the mission was slightly restricted. In fact, we never put in the mission, although it became quite clear that it was a vital piece for the center, that one of our main aims was to strengthen capacity building, because we were aware that there was not enough of us on the ground to really make a huge and massive transformation as it was needed. So you may think that it was slightly narrow-minded, but these are the reasons why that was the decision at the time. I am a person of numbers. I have a fascination, maybe an attraction to numbers, even though I cannot even remember my mobile number. Don't laugh, because when you reach my age, you will be in a similar situation. And so there are numbers in here which were kind of sort of like, very, to me, really reflect some of what we've done. I mean, these numbers are quite incredible, if you think about how, as Vikram and Martin said, we did this thing with very little money. Over the 10 years, we have had more than 100 research projects within our center. We have published more than 1,000 publications within 10 years. We have trained in our master program, more than 200 people, 240 people have gone through our master program. We have trained lots of PhD students. In numbers, we have achieved more than any other center, probably health center, definitely more than any other global mental health center in the world. And this is a massive success. But even though I have a fascination for numbers, I am conscious that numbers do not explain the success of the center. If you ask me, what do I think is the most important asset of the Center for Global Mental Health? Without a doubt, I will say the people. And Vikram mentioned that at the end, the relationships, the friendships. And essentially, this, to me, it is one of the keys of the success of this center. And not just the people, of course, you heard from the founders, but behind the founders, there is an army of invisible, really hardworking people. And, really, these are, please, the list is so long. I, was thinking last night, should I mention all the names? But, it would occupy all my time. So, but, please, always remember that this is teamwork. This is not just the success of 1 or 2 or 3 people. It's the effort and the commitment of hundreds of people here in London, and equally, and perhaps even more importantly, of our partners around the world. Because without them, nothing of what we've done would have been possible. Believe me, nothing would have been possible. And I mentioned in the numbers that currently we're working in more than 30 countries. But if you add up all the countries where we've worked over the last 50 years, there are more than 50 countries, low and middle income countries, where we had a presence. And it's not our work. We help on that, but it is the work of our partners. In all the regions of the world, in Africa, in Asia, in Latin America, some of the pictures you see here, many of them are pictures that I've taken myself because, I never stopped thinking, I just want to remember this thing, I want to remember the people who were involved in this thing. When you spend 5 years working with somebody in Nigeria or in India or somewhere, there are hundreds of people there that made this possible. The success of the center, it is the success of all the people who believed on this and decided to join and do their part. So much as I like numbers, I have to say that people are really the key of the success of this center. We've done lots of projects. You will see in the report, if you want more details, in many parts of the world. We're frequent travelers. We must stop traveling that much now that we can communicate through technology because it's not good for the climate. But anyway, that's another issue that we should think for the future. The climate change should be in our agenda. But, we had lots of successes. This is one, at one point, Martin, I think, mentioned one of the things that you should think when you're trying to create something like this. It's about windows of opportunities. There was, at the time, a window of opportunity when the US government, in an unusual move, I must say, decided to fund 5 mental health hubs in low and middle income countries. And this was one of our most successful moments, because out of the 5 hubs, we were involved in 4 of them. And in some of them, we were leading. In India, in Pakistan, with Share, in Affirm, in Africa, and so on and so forth. These were research, but also capacity building opportunities. But it's just one more example of the successes of the last 10 years. I cannot, when it comes to capacity building, I mean, obviously, our master. Are there any master student, MSc student here in the audience, by the way? Can you raise your hand? Oh, my God. Wonderful to have you here. If there is a history of success, our master is one of those. I mean, definitely one of the top ones. There are lots of people behind the MSc in global mental health that have made it possible. But the MSc in mental health is probably the most acclaimed, the best known master in global mental health in the world. It's got tremendous, I mean, it's sought after, for every 4 people who apply, we just can only accommodate 1 person. It's massively appealing. And it's got, fantastic reviews and feedback from the students. It's an amazing enterprise, and definitely there are some people, not me, who, some of them are here in the audience, by the way, who have to be thanked for this wonderful thing. Some people had the idea, but it is you, people who have worked hard on this, that have made it possible and have been able to maintain it over time. It's not the only capacity building. We do a number of other things, but I wanted to mention Amari, that was mentioned by Fumi in her introduction. Amari was the very first Wellcome Trust funded Delta group in mental health. It's a capacity building. There are at least 50 postgraduate trainees coming up. Some of them have already graduated. And interesting enough, I heard last week of a couple of them who are working in a project in one of the countries in Zimbabwe, because it's not just simply training. The real tragedy in most of these low and middle income countries is when you create capacity and you lose it. It's training and retaining. And it seems that to some extent, the opportunities for research and doing other things are being created at the same time that this new generation is coming up. So they're being attracted and retained by opportunities in their own countries. So in Amari, there are 4 African countries: Zimbabwe, Ethiopia, Malawi, and South Africa. Hopefully, there will be many more in the future. We have had a presence in many other ways. I mean, in policy making, most of the senior members of the center have participated in one or other committee, international organization, World Health Organization, UNICEF, a number of other things. And it's our duty as, to contribute something and to give back to some of these organizations that are trying to do things. And finally, 2 things, just to say, that some of our people are really big celebrities. Unfortunately, Dixon couldn't make it to be here today because he's got, very powerful friends now, so he wouldn't come to see us anymore. And here he is, sitting with nothing less than Jacinta Ardern from New Zealand and Prince Williams. So why would he come and join us here? No, he couldn't make it because he was traveling to another commitment. I want to finish by saying that, it's a history of success, but there are many challenges. There are many challenges ahead. I don't want to spoil the party with the challenges, but there are things, important things. You mentioned some. The social, economic, and political climate at the moment is not really something that is conducive to improve the mental health of the world. It's a big challenge, but it will be also a big challenge because somehow we're going to have to be in charge of the consequences of the mess we found ourselves in. There are other challenges, There are challenges in terms of funding. Still, mental health is receiving a very small proportion of the funding in most countries in the world. A couple of weeks ago, I was invited to give a talk to the ministers of the Americas. It was quite interesting because I said to them that if I had to sort of give them, they were all kind of sort of seemingly interested in mental health, but I said, I think what the world wants to see is a real commitment. If there is one thing that you can change, because in Latin America, the average proportion of the health budget that goes to mental health is 2%. When the global burden of disease attributable to mental disorder is 20%. Now, when I show those numbers to them, they look a bit shocked, but ministers, had learned, one of the first things, if you're a minister, you learn not to show any emotions. So I really challenged them, and I said, if by 2030 you can match the global burden of disease with the proportion of the budget, that will be an amazing achievement. And there are a number of other challenges. I'm not going to go into that. But I just want to say that, as we come to the 20 years, and as Martin and Vikram said, this has not been an easy road. Mental health has been the poor relative of health for many, many years. What you see today is not what we saw 10 or 20 years ago. Believe me, it was a lot worse than this. And we have managed to get here, and somehow it's our responsibility to look after what we've achieved. The center is a center. There are lots of challenges. It's nice to hear that a lot of other people are thinking about setting up their own things, and we need to be prepared. We need to be flexible. We need to think about what comes with the future and adapt our solutions to the emerging opportunities and challenges. So that is what it is for you. I hope that in 2019, 10 years from now, my successor will have much better news than the news that I have given you today. Thank you very much.